Niger State government through Ministry of Health says is strengthening its alignment and collaboration with World Health Organization to improve isolation centers across the state. The State Commissioner for Health, Dr. Murtala Muhammad Bagana, stated this when he received on a courtesy visit WHO representative in his office. The reports.
While giving overview regarding the visit, the World Health Organization WHO representative Pavel Ursu said they have existing cooperation with the Niger State to bring their technical assistance resources to enabling supporting ongoing efforts in health sector of the state. He maintained that the facility inspected so far was a tangible achievement which will give high-quality services to the people.
I'm here, first of all, because we have an ongoing cooperation with the Niger State, with the Commissioner and his team, and we are looking together into accelerating the tangible results which Honorable Commissioner has put forward as a plan. We had a meaningful discussion already in few rounds, and we agreed on a number of very concrete priorities on which we will track together and we will enhance our cooperation. So we are bringing technical assistance and resources to enable and support the ongoing efforts. But we have seen a lot of progress and a lot of energy in the team, and visiting this primary health care center is a reflection of the commitment and all the results which basically are there for people to really use excellent services and excellent infrastructure which is already here. And I've seen the previous center, and I now can see the primary health care center level 2 here, which is an accredited institution, and I can see that the standards, the quality standards here are extremely high. Comparable with the average which I have seen before. And I would like to congratulate, because this is a very concrete, tangible achievement. And this is how also the trust of the community is gained, by showing quality, by showing care, and by showing availability of high-quality services.
Pavel Ursu noted that they have identified numbers of priority, which include to look into the data quality as well as ensuring that isolation service are improved, among other priorities.
First of all, we are looking into the partnerships, because it's WHO, it's basically the leadership of the state, but it's also many other partners who are working in this space. For us, it's very important to make sure that we have a very good flow of data so that we can assess properly the situation and also identify those who are in need for concrete interventions. Second, they are also leveraging the guidelines in terms of the opportunities to correct that, and also leveraging the campaigns and also leveraging the integrated campaigns, which again we have seen that these are already planned, making sure that this area of malnutrition, undernutrition is first of all emphasized, and when the kids are coming for any contact, be it immunization, be it integrated campaigns, there is an assessment and immediately the advice and reference as needed.
Responding after taking the WHO representative around the facility, the Niger State Commissioner, Ministry of Health, Dr. Murtala Muhammad Bagana, said through their series of discussion, they have identified ways of strengthening data for discussion making, joint supervision, and discussing their program in line with the implementation of Niger State Integrated Medical Outreach Program, which is a campaign to be launched in few weeks to come.
Very much. I think this is in line with His Excellency Mohamed Umar Bago New Niger Health Agenda. One thing he made very clear in our vision is our alignment and collaboration with partner agency. WHO, World Health Organization, is the elephant in the room. And we had a series of discussions. We had an external discussion when we visited the UN house in Abuja. Key areas that we have identified, and that was why the WR made a follow visit to Mina, Niger State. One is strengthening data, using data for decision making. The second area is around joint supportive supervision. What we are doing exactly today is around joint supportive supervision. We don't want government to go for supportive supervision separate from partners. So we're encouraging this joint supportive supervision. We also talked about improving and rehabilitating our isolation center. We just visited there. Supporting and improving a rehabilitation center like the isolation center requires that we follow the best practices. WHO are very good at doing that, providing the necessary technical assistance and expertise around, building or rehabilitating an isolation center. We did also talk about one of the major campaign that we'll be implementing in the next couple of weeks.
Earlier, during the meeting, the commissioner delivered the message of the Deputy Governor, Comrade Yakubu Garba, to the hearing of the gathering. Ahmed Yusuf reporting for NSTV News.